Honorable Orville London, Chief Secretary, Tobago House of Assembly, and sitting in for our vacationing Secretary for Health and Social Services, Mr. Albert Pilgrim. Mr. London.
Thank you very much, Mr. Chairman. Let me take the opportunity to recognize all the secretaries and assistant secretaries of the Tobago House of Assembly. Special recognition, of course, to the Assistant Secretary in the Division of Health and Social Services, Mr. Cadet, who, as you recognize, would have played a very important role in this activity. I'd like to recognize, of course, Mr. Casey Roberts, representing the Minister of Tobago Development, my namesake, Mr. Orville Jordan, the representative for this area. Of course, the administrator in the Division of Health and Social Services and other administrators, the chairman of the board of the Tobago Regional Health Authority, and I see a number of the directors here. I want to recognize them. I'd like to recognize Mr. George Bell, the CEO of the Tobago Regional Health Authority, and I'd like to specially recognize the other members of the Tobago Regional Health Authority and the Division of Health and Social Services team. I see in the front row Dr. Ayabuna, Primary Care, Dr. Remy, Advisor, Dr. Angus, Mr. Fredericks, Dr. Radix in the back. I also see, of course, the AO5, Ms. Lawrence, very hard-working, Mr. Taylor, and of course, the lady who's going to follow me, Mrs. Pooka Beckers, and the nurse. Stakeholders, special invited guests, members of the media, ladies and gentlemen. Ladies and gentlemen, there are times when I wish that the protocol could have been reversed, and that instead of the Chief Secretary speaking last, the Chief Secretary should speak first, because you have a situation where 5 individuals, all of whom are supposed to know more about this project than I, speak at length, and then the chairman going to mamaga everybody and say the highlight is going to be given by this. But it's all right. So let me just start by taking the opportunity to especially commend all of those who had anything to do with this exercise. And you know, sometimes you judge people by the end result, the success. And sometimes you criticize people during the process, especially when there are challenges, not recognizing that sometimes you actually have to give people additional credit for being able to surmount these challenges. And if there's one project that had challenges, it is this project. And if it is one project that demonstrated that with the will and the commitment and the dedication and the collaboration, challenges could be surmounted and success could be achieved, it is this project, and everybody associated with it should be commended, and I wish you to commend it. I'd like you to also especially commend the Tobago Regional Health Authority. And this is going to be my last opportunity, and I want to pay public tribute to the members of the Tobago Regional Health Authority who have labored for the past 2 years, sometimes under very difficult and frustrating circumstances, and have been able to deliver in a number of areas. I want us all to put our hands together for Chairman Mr. Keith Charles and his team for their achievements over the past 2 years. And of course, as any good chairman, what he would have done is to indicate what the board would have done over the past 2 years. And maybe that is something that we don't do often enough and don't do effectively enough, which is to boast a little about what we have achieved, and therefore we tend to get judged by what we did not achieve. I want to indicate, as he said, that the term of office of this board ends later this week. And I want to advise you people here and the people of Tobago that, as is our legal responsibility, the Tobago House of Assembly is going to appoint or going to select the new board. That process started last week at our Executive Council meeting when we approved the names of the new board That will be confirmed most likely when we meet again on Thursday, and then the process will continue. It goes to Cabinet and then to the President, and that is how the appointment will be made according to the law. I want to join in expressing our pride in this facility. It is a magnificent facility. It's comparable to any facility, not just in the country, but in the region. And you know, I want us in Tobago sometimes to appreciate what we have, not only in relationship to what we used to have, because you can't just compete with the past, you'll always win. What you need to do is, of course, to compare with what is going on in the rest of the country and the rest of the region, and among the developing countries in the world. And where the infrastructure is concerned, as exemplified here, as was exemplified in Roxborough a couple of days ago when we opened the Roxborough Walk-in Clinic, signals to all of us in the strongest possible way that where the physical infrastructure is concerned, Tobago is way ahead of Trinidad and the rest of the region. And that is a fact. Nobody could dispute it. Because look at this facility. Costs over $28 million. You're talking about over 30,000 square feet of space. A range of services including dialysis. I want you to go into go on the internet and tell me any place in Trinidad and Tobago, any place in the region where one of the health facilities, not the only one of the health facilities is a facility built at the cost of $28 million, where you have available 30,000 square feet of space to service the people of Tobago. But I'm asking you a question. You know, sometimes those of you built a new house. You build a new house and the first couple of weeks, you find yourself going home, looking at the house, it looking nice and so on. And then maybe after 6 months, you have difficulty in remembering the color of the roof. You have difficulty in remembering how much you pay for the stove. You have difficulty in remembering where you bought the fridge. Because at that point in time, what matters is whether the roof is keeping out the rain, whether the fridge is keeping the food cold, and whether the stove is cooking the food. And I indicate to you that to you, brothers and sisters, because we have to look at this as a magnificent structure, a magnificent building. And our challenge is, how do we translate it into a magnificent facility? Because that is what the people of Tobago want. The people of Tobago want a magnificent facility. And I want to suggest to all of us, and I think the administrator started the process, when she indicated to all of us, because I'm also going to say that we the people have a responsibility. She indicated to all of us that this facility is a challenge. It is an opportunity, but it is also a challenge. And what she's saying, that you cannot behave and conduct yourself in a less than magnificent way in a magnificent facility. And therefore I want to join her in hoping and expecting that this facility, the quality of the facility, will of course encourage us as we move towards improving the healthcare delivery in Tobago and bringing it up to a level of which we can all be proud. So in the final analysis about service. And service is about response to needs. And I made the point at Roxborough, which I think bears repetition, that response is a two-way street. That in the first place, we who are supposed to deliver must respond to the needs of those to whom we deliver. But I'm also saying those to whom we deliver must also respond to our response. And it's the point that was made by a number of the speakers, that we in Tobago have got to recognize that the delivery of healthcare services and the improvement of the quality of healthcare in Tobago is not the prime, well, I wouldn't say the prime, it's not the sole responsibility of the healthcare delivery agents. It has to be a collaborated effort. And it is in that context that I'm hoping that all of us will recognize that we have a role to play in the primary care aspect of healthcare delivery in Tobago. And I'm going to tell you today that I am going to judge to a certain extent, or one of the factors that I will use to judge the success of this facility is what, as one person mentioned, happens at the hospital. I want to see a situation where the numbers in the hospital go down dramatically, not because people have lost confidence in the hospital, but because people have gained confidence in this particular facility. And you know, I heard the chairman talk about a four-point plan, you said? And I want to suggest a four-point plan for building confidence. In the first place, and that is what we started today, it is to disseminate information. People must know. People must know what is happening here. They must know the services that we have. They must know the hours of work, etc., etc. Nothing wrong with that. And then you got to market the facility, because there's a difference between disseminating information and marketing. And that has got to be done aggressively, because too many of us believe that because you're doing a good thing, that people will automatically gravitate to it. That is not how life operates. We have a responsibility to market a good thing as aggressively as other people market not so good things. And the third thing, when you market, you go